Yes.
Um, really what this is about is as we kind of move to more of a mass vaccination effort, one of the things that the state said they're going to need are more hands, more people who have experience or who are readily available and willing to help with the administration process. Can you talk about kind of the efforts on your end and what you're seeing at Penn State Health as folks kind of get ready for what's next?
Yeah, thanks, Brian. As you mentioned, it's going to be a big effort for mass vaccination, especially as we roll out into the community. So Penn State has had a great response. They've really protected their students. So during quarantine, where some of the trainees were not actively involved in care of patients due to COVID risk, we found other ways to get involved. One of those that I was participating in was contact tracing for people who did contract COVID-19. And we had great success with patient buy-in. We just had passionate students who were able to communicate with our patients. And reading a few months ago about the coming vaccines, our lack of infrastructure, but then also workforce, a couple of us students got together and said, hey, we've seen with our experience that we can do something here. Let's try to provide a workforce ahead of the need so that we can start rolling as fast as possible. So Monica Manglani, Ashley Sun, and I got together and kind of brainstormed some things and pitched them to the student leadership and then also the faculty leadership that are in charge of COVID response electives about training our students to give vaccines and then provide education about coronavirus in general, COVID-19 and the vaccines. And we've just had a great response. Students were super excited across graduate programs, medical programs, physician assistant programs to get involved. We've trained over 100 students so far, and it looks like that's continuing to grow. And at first, it was to provide vaccines to our Penn State Health healthcare providers who are taking care of COVID patients, and we've run through the tiers there to those with less and less direct patient care. And now we're looking forward to the next stages, which will be our patients and then the wider community. So we just tried to get ahead of that curve and provide a trained, knowledgeable workforce that could be flexible in however we were needed for rollout.
Yeah, I mean, as far as getting ready, I mean, was it easy to predict that this need was going to exist just based on what you were able to see with the contact tracing and testing efforts and what you could see without, throughout the health system? I mean, was it easy to kind of foresee that, hey, down the road, this is going to be something that's critical?
Yeah, and it wasn't recent, it was months ago. We knew that the entire world was focusing on a vaccine, and luckily many vaccines. So we knew eventually it would be necessary to have a mass vaccination effort. We didn't know what it was going to look like, but as that started getting closer, there were candidates finishing phase 3 trials. They were having good efficacy data and good safety data. We knew we were just going to need a lot of hands, and those of us who have been rotating through the family medicine primary care clinics saw how current vaccines are administered and how that was just going to be overwhelmed. So it's one of those things where it takes a lot of effort, which usually equates to money and time to build these things, and we can just use our student workforce. But we saw it coming, and I'm sure a lot of other people saw it coming as well.
Did the state have to lift any restrictions to make this possible for, students to take part in this, maybe some of the unconventional groups to play a role here? And what kinds of things did you have to do to prepare? Was it relatively easy to get ready to do this? And how many of you would you say ultimately you'll be able to help and contribute?
So the state didn't have to lift any restrictions. As health professions students, we are able to participate in these types of activities through our clinical duties. We have also enrolled other non-medical students, students in public health, and graduate students who have chosen to participate. And because of their affiliation with Penn State, they are permitted to do such activities with proper training. So we wanted to make sure that we were covering our legal and safety kind of requirements.
More about desire, right, Derek? Like just the desire to want to help, not necessarily like any restrictions in the way. It was just saying, hey, we need to step up and help, and how many of you want to do it? And most of the people have said, you know, we want to help, and kind of reaching out unconventionally, you think?
Yeah, I think
Yeah.
it's been tremendous. It's been almost overwhelming, the responses that we've got, more so than we can keep up with to effectively train an apprentice there. We've had several hundred students respond via email saying, yes, I so want to get involved. Please put me on this process of training to get involved across kind of all the student spectrum throughout Penn State.
Awesome. Well, I think that's all. That's all I got for you. Did you have anything else you wanted to add?
I don't. I just want to say thank you for providing us the opportunity to kind of share some of the success. I do want to share that I'm only one person talking to you here, but as our student task force and our student leadership, Monica and Ashley have been a big part of this, and we couldn't do this without really just full support from Penn State Health in general. It's been a great team to work with.